do it now. Who wants to go through 2 more rounds of chemotherapy if they don't have to? It's pretty nasty stuff. So, diagnosed in 1994 in March, had my transplant in October of 1994. So now, same with Oscar, I have 2 birthdays, which I'm still trying to convince my husband of. But I get one on June 21st and one on October 4th. So October 4th was my birthday, my new birthday. And Stanford did the same thing. You know, I had a big calendar in my room. Every day they'd write my counts on it. I had a big birthday cake drawn on October 4th. That was my transplant date, and that's my new birthday. So, so it's an allogeneic bone marrow transplant. A lot of times nowadays, that with medicine being so advanced, people get an autologous bone marrow transplant. They use their own bone marrow to have a transplant. Luckily for Oscar and myself, we didn't have to do that, which includes a lot of drying out the marrow and cleaning it up and then giving it back to you. And there's a higher risk with that they didn't catch cells that are cancerous that they would give right back to you. So we were lucky in that respect. My brother didn't have it as easy as Oscar's sister, though. He had to have his bone marrow harvest from his pelvic bone. So they actually do drill into the pelvic bone, draw out the bone marrow. Don't let that scare any of you, because nowadays, I guess they're just doing it like taking blood from you. So being a bone marrow donor is as easy as pie, just like giving blood for being a bone marrow donor. It's you're saving a life for nothing, really. You replenish your bone marrow within 2 weeks of what they take from you. So it's really nothing. I was already engaged when I was diagnosed. A lot of times that would scare somebody off. Not my husband. He stuck around. Finally got married in 1996. Came to UOP. Dr. Oppenheimer, was that your first year? First year. Dr. DeGuire was here as well. Place has changed quite a bit. You guys got nice new facilities. We had all of our lectures in the rotunda. Received my degree in 2000. Stayed with Longs. We are now CBS, so I'm still there many years later. As I talked about, the inability to have children. I am postmenopausal, medically induced. So Ryan is on the right there. That's my son. He was donor egg, husband sperm, and my aunt actually carried him for us. So he is a miracle baby. He's my popsicle boy. He was frozen. He was a second try. So he was a frozen embryo that we thawed out and grabbed on hold to that uterus, and here he is 5 years later. And then the one on the left is Savannah. Savannah is in foster care, and my husband and I are hoping to adopt her. So that's our life right now. This is before diagnosis. This is actually a picture that I just dug up. That was in November of 1993. I was diagnosed in March of 1994. This was just a few months before I was diagnosed. That was my fiance, my husband now. That's just a little bit of info about leukemia. Most common in pediatrics is ALL, which is why that was one strike against me, was that I was an adult who had a child with leukemia. We don't know how you get it. My brother, obviously 6 out of 6 match, were pretty genetically close. He never got it. So there's really no way to know how you get it. Fatigue, because of the red blood cells being pushed out. Infection, because your white blood cells don't work. Easy bruising, again, platelets are getting pushed out, they don't work correctly. And bleeding because of the platelets as well. Treatment, radiation and chemotherapy. Typically chemotherapy is first line, but it depends on what you're doing when you have a bone marrow transplant. you need your bone marrow completely gone. Said your white blood cell count is none. You have 0 white blood cell count when they do the transplant. Like we were saying, talking about the total body radiation, they made me metal shields for my lungs. They literally stick you in a cage. They strapped me into the cage so that you don't fall because it's very, very tiring. 15 minutes of just standing there still with it's talking about x-ray machine is this, this little machine. This was like a huge, huge machine shooting radiation at you. And like I said, the mucous membranes, I had mouth sores like there were no tomorrow. One of the problems with, or I wouldn't say problems necessarily with the bone marrow transplant is something called graft versus host disease, where your body is basically responding against yourself, because you have this new blood in you that is really not you, and so your body is responding against it. Most of the time, graft versus host disease, to a small extent, is a good thing. They found that patients that have some form of graft versus host disease have a larger percentage of survival. I had graft versus host disease in my gut, so that prevented me from eating. I was in the hospital for about 45 days because I wasn't eating because of the graft versus host disease, but 16 years later, I guess that's a good thing that I had it. This is my brother. He actually stayed overnight, but that's because he's a man. He's a baby. Most people that were donors back then, you're in and out in the same day, and back to work the same week. But he's a baby. But you can kind of tell he's got hair up there. You'll understand that in a sec. So this is the bone marrow. Is this it? Yeah. So up at the top. It just looks like a bag of blood. But that's the bone marrow that they harvest from my brother. So one thing that my mom was really petrified about was, so I went into the hospital on a Monday for my bone marrow transplant. They did a few tests, some things. They had to fix my catheter and things like that. The next 2 days were chemotherapy, which were about 6 times the chemotherapy I'd had previously. So it's pretty sick stuff. Pretty sick stuff. It makes you pretty sick. The next 4 days were total body radiation. Then I had a day of rest. And then my brother came in, and on that Monday, they harvested and brought the bone marrow right over to me. And my mom's paranoia was, what if he gets in a car accident on the way to the hospital and he dies? And I had 0 white blood cell count. So, just wanted to let in. That was me. A little bit of a moon face. Friend zone, my friend. Yeah. So, after chemotherapy, your hair falls out. And then after so long of not having chemotherapy, hair starts to come back in. Oh, but then you need more chemotherapy, so hair fell out again. Then you have a little bit of time before the bone marrow transplant, hair comes back in, and hair falls out again. It's just a cycle. So like Oscar was talking about, they had to wear masks, had to scrub. I was in a negative pressure room, so there was a room in between the hallway and my room that sucked the air out when they walked in, sucked air into the medium room. So they'd have to scrub up like doctors do with those little scrubber things, scrub all the infection off. Nice thing was that everyone else had to wear a mask, but I didn't. And this was Christmas time, so I had my transplant in October, and so this is 2 months later, and I still had that characteristic moon face. I can remember sitting in the rotunda when we were learning about the effects of prednisone, and one of the teachers put a slide up there of stretch marks on the stomach because of thinning skin, the hunched back, the moon face. I said, wow, that's me. That was me to a T.